And we're back with Dr. Tim McKnight as we talk with the doc this morning about, well, I'll let you talk about this. It has to do with dementia, which kind of seems to be in the news a little bit more often these days. And there's more than one kind, and there's preventions and tips. And so where do we go?
Well, I think a lot of people feel like they're victims, and it's a powerless condition, and it's degenerative. And unfortunately, when we use the drugs that we have, it slows the process down, but there's not a lot of talk about either prevention or reversal or really slowing it down. And ultimately, we need to talk about the root cause, because if we understand that, then we can intervene and do things to slow it or even prevent it. So we know that in 30 years, the number of Americans who have dementia are going to double. There are 6.5 million Americans who have it now, and by 2050, we're predicted to have 13 million.
That's scary because the population's not going to double.
That's right. And so that means this is a problem that's accelerating. And the key word here is inflammation. I want people to understand that this is an inflammatory process. It's chronic inflammation. So if we can control chronic inflammation or reverse it, then we can have an impact on it. But as with many diseases, with hypertension and heart disease and cancer and diabetes and even Alzheimer's dementia, the issues of inflammation start 20 or 30 years before the diseases manifest. So we're talking about 30 and 40-year-olds need to be aggressively fighting inflammation now. So how do you know if you have inflammation? Well, if you have high blood pressure, you're inflamed. If you have belly fat, you're inflamed. If you're sleep deprived, you're inflamed. If you're not eating the right foods, you're inflamed. If you have joint pain, that's a sign of inflammation. There are a lot of clues about inflammation, but the experts have recently, and I think we mentioned this before, called dementia, Alzheimer's dementia, type 3 diabetes. It's an inflammatory problem, and the root cause is the inability to get glucose or sugar into the brain cells. So they become resistant to the effects of insulin. So when you have insulin resistance, you can have skin tags on your neck and have belly fat, be overweight, have blood pressure problems, and that's a sign of this chronic inflammation that we call insulin resistance. So again, it starts with the beginning process is not able to get energy into the cells in the brain because the insulin isn't working. The insulin receptor is not telling glucose, okay, you can go into the cell. So the cells are starving for energy. And that when anything is starving for energy, it panics. So there's the beginning of an inflammatory process. We also know that there's an enzyme called insulin degrading enzyme, and the body has checks and balances. We make insulin, but then we have to get rid of it. So there's an enzyme that does that. And when you have when this enzyme is impaired, as it is with insulin resistance, now you can't clean up the junk and the debris in the brain cells that lead to this process of dementia, because what it is a series of chemical changes on the nerves that just sort of stiffen everything up and interfere with the processing of nerve functions. And the two key elements here, we call them neurofibrillary tangles and a tau protein. And that all begins with this process of injury to a protein called beta amyloid. Now, I know that I'm throwing out a bunch of technical terms, but beta amyloid is something that our body makes to help us kill yeast and streptococcus and E. coli. So it's supposed to be there. But when the brain starts to get inflamed, then it can't clear the beta amyloid. And then when we have inflammation in the brain because of these lifestyles, then that's the beginning of these changes that we can see on histology slide in the brain tissue. So we also know, in addition to the inflammatory things that happen when we have insulin resistance, there are nutritional defects or nutritional deficiencies that make inflammation worse. So we need to talk about those things that correct that. We know there are environmental toxins that inflame the brain, inflame the entire body. But they've identified things like dioxins, which are loaded in animal products that we eat, beef and fish and dairy, because of the pesticides that many of these animals consume. Then there's PCBs. There's mercury and lead and hydrocarbons, and all these minute exposures accumulate over time. They cause chronic inflammation, and these effects can be seen in the brain as well. So we know that what's interesting is my mother had terrible dementia. My grandmother had terrible Alzheimer's dementia. It was an awful process for 5 years. She didn't know anybody. Wow. And my dad was just spoon feeding her every day at lunchtime, and she didn't know him. And so it's a terrible disease. But what's interesting is the genetic component is much weaker than we thought it was. So just because she had dementia doesn't mean I'm going to have it or someone in my family.
Right.
My father's, he's the one of 4 siblings, and they're all past 85, up to 97, and they don't have dementia because of some of the lifestyle choices. But we know that, again, the risk factors are obesity, especially abdominal obesity, smoking, a sedentary lifestyle, abnormal cholesterol levels, insulin resistance, high blood pressure, and sleep apnea. So this is all really relevant because we're talking about how do we prevent the process of the beginning stages of dementia. We have to stop inflammation. And the more belly fat you have, the more inflammation you have. So we can't afford to be eating too many of the wrong foods. We know that exercise is critical. Exercise diminishes inflammation, helps get rid of the belly fat. Interesting also that sleep is crucial for the prevention and even for the early intervention of Alzheimer's, because during sleep, that's when all the tangles and the inflammation in the brain cells are cleaned up when we have deep sleep. I mentioned before, when we have deep sleep, our body heals from its ailments. So a broken bone, a cut, surgery, we have to have deep sleep. And the same with our brain. The brain can heal itself. It's got the ability to rid itself of these bad chemicals with good sleep. But so many of us don't sleep well.
Yeah.
So we know that melatonin is a really good anti-inflammatory. It induces good quality sleep, and it's crucial. So if you're not having good sleep in your 40s and you're getting belly fat and your blood pressure is going up, you need to address all these things. I've recently doubled my melatonin from 5 milligrams of slow-release melatonin to 10, and I sleep great, and I feel much, much better.
Now, this is not a drug, so it doesn't have any side effects.
No. Well, for some people, it can cause vivid dreams, and if you take too much, it will make you tired in the morning. So you just have to try it. But yeah, this is completely natural. Your brain makes it. It just doesn't make it well as you get older. We know that vitamin D is an important treatment in the prevention of dementia and in the early development of it. Vitamin D is this powerful anti-inflammatory, and it's really a hormone more than a vitamin. Omega-3 fatty acids are anti-inflammatory. You're not going to get omega-3s in the vending machine and at fast food restaurants. You're going to get those.
Come on.
Yeah, sorry. You're going to get those in the produce section of the grocery store, in plants. Homocysteine, when that builds up, that's another marker that I look at for heart disease, but that's also a sign of inflammation, and you can correct that with a B complex. Give yourself vitamin B12, folic acid, biotin, all the B vitamins. Just take a B complex every day. CoQ10 is important. Managing stress is important, because if we don't manage stress, our cortisol levels go up and then they drop, and when they drop because we're just stressed for too long, there's more inflammation. A couple other things that are really interesting that I love, because I love the benefits of hormones. Thyroid can be extremely helpful in ramping up metabolism and fighting these inflammatory processes. So a good thyroid, levothyroxine and synthroid, are not the thyroids that you want, because that's T4. Your cells respond best to T3. Interesting research I heard over the weekend is if you take these synthroid and levothyroxines, it will actually reduce your T3 levels, and you'll have more inflammation. You'll have more, your metabolism will be slower, and you'll have worse, your lipid profiles will be worse. But another one that's really interesting, if you observe this, is estrogen. Estrogen is so crucial. If you look at people who have Alzheimer's dementia, 2/3 of them are women. Now, why are women unique? Well, the only thing different really is the reproductive cycle. That's really the only difference, estrogen and testosterone. So when a woman goes into menopause, there's a decline in estrogen, and that's when they really start to develop these problems, because estrogen is very anti-inflammatory. It keeps fat down. What happens to women when they go into menopause? They gain weight. Most of them gain quite a bit of weight. It's not because they're eating wrong or they're not exercising. It's because they've lost estrogen. If you replace estrogen, you'll lose weight. I've even heard of men who take estrogen as a supplement, and it helps them get rid of weight. There's nothing wrong with estrogen in men and women both. It's just you have to find the right amount. So estrogen's really important. If you've had a hysterectomy at a young age, your risk of Alzheimer's dementia goes way up, as does your risk of heart disease and obesity and diabetes and osteoporosis. So we want to maintain these healthy levels of estrogen our whole life. Men need estrogen too, but we primarily get estrogen as we have good testosterone levels. Some of it converts to estrogen. So, and then two other things that I think are key. I mentioned exercise. Exercise helps stimulate the removal of these waste products in the brain just because of blood flow. We call that the glymphatic system. There's lymphatics and other ways in the brain to get rid of the waste products. And then the final observation of the studies support the idea of a meaningful or a purpose in your life, having a purpose, a reason to get up every day. You're going to go help these people. You're going to go do this. That's also been associated with a lower risk of dementia. Huh. So the point I'm making is this is an inflammatory disease. It begins with insulin resistance, which starts with being overweight, whether you're a woman in menopause who's gained weight or you're just someone who hasn't done much and you've gained weight. But then we have to sleep good. We have to get good exercise. We need to eat well. We need to have omega-3 fatty acids in our diet, vitamin D, B vitamins. Choline is another good one, CoQ10, manage stress, optimize hormones. And see, this is so much more empowering than just, you've got dementia now, here's your Aricept.
Right. Yeah.
I mean, remember, the process starts 20 to 30 years before we see it.
If you're seeing those red flags, start now.
Absolutely. And I would say even start in your 40s and 50s. Yeah. Because once you get to that severe stage, it's really hard to do much about it. I would still do these vitamin supplementations. I'd still recommend thyroid and estrogen, but we want to intervene early. And the fact that we're going to double this in the next, 30 years, that's unacceptable. The fact that diabetes is going up in similar rates, and cancer is the same process. It's an inflammatory problem with insulin resistance. And it comes back to our foods, our inactivity, our weight, all this stuff. So this is the whole purpose of the Fit for Life program, is to educate people on these healthy lifestyles. And I try to motivate people. Look, I don't want you to exercise because I want you to run a marathon. I want you to do it for your brain and your heart and your kidneys and your blood sugar and your liver and all these things. Yeah. So I hope that helps a little bit. I hope people feel a little bit more empowered to not panic about Alzheimer's dementia. That's just one of the two types. The other type is the blood vessel dementia. We call it multi-infarct dementia, where there's tiny mini strokes happening in the brain. It's essentially the same process. The same process that causes heart disease causes these mini strokes. And these are usually events where there's a sudden change. Boy, dad or grandpa just all of a sudden, his mind, he just got forgetful all of a sudden. Mm-hmm. Or he couldn't speak the words that he was wanting to speak. When those things happen quick, that's a blood vessel issue, but it's the same process. It's the same treatment, essentially, in most aspects. So I hope that helps people feel a little bit more able to not panic and to prevent the process, and so it's not one of those diseases that we're suffering from.
Right. And don't be afraid to ask your physician.
Yeah, ask your physician. And many physicians aren't aware of this because we're trained to treat with medications when we see somebody clearly has it, but we want to intervene early. We want to prevent these diseases. We're designed to live 120 years and thrive and do very well, not 60 years and then 5-10 years in a nursing home. Right. Not acceptable.
Dr. McKnight, thank you.
All right.
Hopefully that can happen with us. We thank Dr. McKnight every Tuesday, as our Talk with the Doc is brought to you by Mako's Pharmacy,